Welcome to PCA Deep Dive, a service of the Pennsylvania Chiropractic Association. Today, we're examining a question that sits at the intersection of healthcare policy, student safety, and regulatory consistency. Return-to-play decisions, sideline care, and the role of sports-trained doctors of chiropractic. In professional sports, collegiate athletics, and even on Olympic teams, chiropractors with advanced sports credentials are a mainstay of medical staffs. They evaluate musculoskeletal injuries. They help manage recovery. They support return-to-play decisions in some of the highest-stakes athletic environments in the world. Yet in Pennsylvania, interscholastic athletics, those same licensed professionals can face restrictions when it comes to working with student-athletes. Why? This episode is not about scope expansion. It's about inefficiency. It's about student choice. It's about rural care deserts. And it's about whether current policies reflect the statutory authority already granted under Pennsylvania law. When trained providers are limited from serving communities that face healthcare shortages, families feel it, schools feel it, athletes feel it. Today we're going to unpack how this disconnect developed, what the law actually says, how advanced sports chiropractic training fits into the conversation, and why regulatory clarity matters. Let's take a closer look.
I want you to picture a scene. It is Friday night in Pennsylvania. It's late October, so the air is crisp, maybe a little frost on the grass. The stadium lights are humming, that specific buzz, and the entire town is just packed into the bleachers.
It's the classic American tableau.
Exactly. High school football in PA isn't just a sport. It is a cultural staple. It is the heartbeat of the community. But while everyone's watching the game, there is a very different, very bureaucratic struggle happening behind the scenes. It's a struggle over who is actually allowed to keep those athletes safe.
And it is a struggle that, when you really look at the documents we have today, it seems to defy common sense.
We're digging into a stack of documents from the Pennsylvania Chiropractic Association, or the PCA, and they are in the middle of this massive push for what they call regulatory clarity. And I have to say, looking at these sources, it feels like we are looking at a system that is, well, that's glitching.
Glitching is a polite way to put it. I mean, regulatory clarity is the diplomatic term. But what we are really talking about is a disconnect between state law and the rules on the actual playing field.
Because here is the premise that jumped out at me immediately, and I had to double-check this because it sounded so wrong at first.
Yeah.
You have licensed chiropractors who are treating professional athletes on the Pittsburgh Steelers, the Philadelphia Eagles, the Pirates. They are on the sidelines for the pros. They are clearing multi-million-dollar assets to play.
Correct.
But under current regulations, those same doctors with the same licenses are often restricted from clearing a high school sophomore to return to the field after, say, a strained ankle.
It is a massive contradiction. And before we go any further, because I know we have listeners who might be skeptical or thinking, oh, here comes a sales pitch for chiropractors, we need to clarify what this deep dive is and what it isn't. The sources are incredibly emphatic about this. The PCA is not asking for scope expansion.
Okay, let's unpack that immediately, because scope expansion sounds like bureaucratic jargon. What is the actual difference between expanding scope and what they want?
It's the difference between asking for a new power and asking to use the power you already have. Scope expansion implies asking the legislature to, change the law so you can do something new, like, say, a chiropractor asking to perform minor surgery. That's not what is happening here at all.
So they aren't trying to rewrite the medical rules?
Oh, no. They are arguing for scope confirmation. They believe that under the existing Pennsylvania Chiropractic Practice Act, they already have the legal authority to diagnose and manage these injuries. But the policies of the PIAA, that's the Pennsylvania Interscholastic Athletic Association, are blocking them. They want the state board to essentially say, yes, your license already covers this. PIAA, please update your rules.
It's like having a valid driver's license, but the parking lot attendant tells you you aren't allowed to park there because he doesn't think you know how to drive.
That is a surprisingly accurate analogy.
Yeah.
They have the state license. They just need the athletic association to recognize it.
Okay, so let's get into the nuts and bolts. What exactly are they being blocked from doing? The sources outline three main pillars here. It's pre-participation exams, return-to-play decisions, and sideline care. Let's start with the first one, PPEs.
Right. The pre-participation exam. This is the standard physical every student-athlete needs before the season starts. It's a screening tool. You check the heart, lungs, joints, make sure they aren't going to collapse on the field.
And currently,
Currently, PIAA regulations create these significant barriers for chiropractors performing them. The implication is often that chiropractors are just back doctors and can't assess the whole body.
which is where the PCA pushes back.
Hard. They argue that chiropractors are trained in what's called differential diagnosis. This is a key concept. It means they are trained to tell the difference between a musculoskeletal issue and something systemic. They learn how to screen for cardiac issues, respiratory issues, all that.
So the argument is, if a chiropractor hears a heart murmur during a physical, what do?
They refer it out to a cardiologist, just like a general practitioner would. I mean, a GP isn't going to perform heart surgery. They are going to refer. The PCA argues that for the 90% of the physical, that is orthopedic check-in joints, flexibility, strength, they are actually the specialists.
Which brings us to the second pillar, and honestly, this feels like the one that causes the most headaches for families. Return to play, or RTP.
This is the authority to sign the paper that says, you are healed, you are safe, get back in the game. And again, we need to be precise here. The proposal is specifically regarding musculoskeletal injuries.
So if a kid has a concussion or a cardiac event,
The standard protocol applies. But if a kid sprains an ankle, tweaks a hamstring, or throws out their back, the bread and butter of chiropractic care, the PCA argues, we treated the injury, we know it's healed, why can't we sign the note?
and the third pillar is sideline care, being the doctor on the field when the injury happens. Now, here is where it gets really interesting, because I think there's a misconception that the PCA wants every chiropractor on the sideline.
That is the crucial nuance that often gets lost in all the turf war noise. The proposal isn't saying that, your local chiropractor who strictly does spinal adjustments in a quiet office should be running onto the football field to treat a trauma.
Right. The documents were very specific about credentials. They aren't just flashing a generic diploma.
No, they're highlighting a specific subset of the profession. Doctors with advanced credentials like the CCSP, that's a certified chiropractic sports physician, or the DACBSP, which is the diplomate level.
And that's not just a weekend seminar where you get a certificate and a bagel.
No, definitely not. We are talking about a minimum of 100 to 300 plus hours of postdoctoral training. This covers emergency procedures, airway management, spinal boarding, concussion recognition, on-field stabilization. These are the folks trained to handle the chaos of a live sporting event.
So they're essentially saying, look, we have done the extra homework. We have the specialized board certification. Just let us use it.
Exactly. It creates a tier of providers who are specifically equipped for the sideline.
So why does this matter? I mean, beyond just professional pride for the chiropractors, why should the listener, maybe a parent, maybe a school administrator, care if a chiropractor or an MD does the physical?
That is the million-dollar question, and the answer really lies in the geography of Pennsylvania.
The rural healthcare gap.
It is the single most compelling data point in these documents. 60% of Pennsylvania counties are designated as health professional shortage areas, or HPSAs.
60%. That is more than half the state.
It is. In many of these rural districts, you don't have a team physician. You might not even have a full-time athletic trainer. The nearest orthopedic specialist or pediatrician might be an hour, maybe 2 hours away.
I can visualize that.
Yeah.
You're in a small town, Friday night game, a kid twists a knee. There's no MD on the sideline because the town simply doesn't have enough of them. The bench is medically empty.
But there is often a board-certified sports chiropractor in town. They live there. They practice there. They're part of the community. The PCA's argument is, if a rural school can't find an MD to stand on the sideline, but there is a fully qualified sports-certified chiropractor sitting in the bleachers willing to do it, why is the state preventing them from helping?
It just seems so inefficient, maybe even negligent, to bench a qualified medical professional when you have a shortage.
It really challenges the logic of the system, and they point to neighbors like West Virginia. In West Virginia, chiropractors help fill these voids in rural medical coverage. It's a model that is already working right next door. They aren't inventing the wheel. They're just pointing across the border.
Speaking of inefficiency, I want to talk about the referral loop. This was described in a letter from a Dr. Justin Miller included in the sources, and it paints such a picture of the frustration families face. It's almost bureaucratic comedy if it weren't affecting kids' lives.
This scenario is the real aha moment when it comes to the cost to families.
So let's walk through it. Dr. Miller lays out this scenario. A high school linebacker hurts his back on a Tuesday practice. He goes to his chiropractor, Dr. Miller. Dr. Miller treats him, rehabs the injury. By Thursday, the kid is feeling 100%, full range of motion, no pain. He's ready to play.
Medically, he is fine. But under current PIAA rules, Dr. Miller cannot sign the note to clear him.
Exactly. The kid is fixed, but he's not cleared. So now this family has to scramble. They have to make an appointment with their general practitioner or an orthopedist.
And in a shortage area or just in the modern healthcare system generally, that appointment might not be available for 48 to 72 hours.
Right. So the kid misses the Friday night game. He might miss practice on Monday. And the parents, they're driving to another doctor, paying a second copay, maybe taking time off work.
And here's the part that drives me crazy as an analyst. What happens in that second appointment? The GP looks at the kid, asks, "How do you feel?" Good. The kid says, "Fine." And the GP signs the paper.
The GP didn't even treat the injury. They might not know the treatment history. They are just a rubber stamp at that point.
Or, and this is worse, to protect themselves from liability because they didn't see the injury happen, the GP refers the kid to physical therapy just to be safe. Now you're adding weeks to the process and hundreds of dollars in costs.
For an injury that was already fixed.
Exactly. It completely disrupts the continuity of care. You have the provider who knows the injury best being silenced at the most critical moment, the decision to return to play. It hits the families in the wallet, and it hits the athletes in their playing time.
It feels like the system is prioritizing the signature over the actual patient care.
That is the core of their argument. It's bureaucracy over biology.
So we mentioned West Virginia earlier, but let's look at the bigger picture. Is Pennsylvania just doing what everyone else is doing, or are we the odd one out here?
Not at all. In fact, the data provided by the State Relations Committee shows that Pennsylvania is a distinct outlier. Well, look at states like Ohio, Texas, West Virginia. These are big football states, you know. They all allow doctors of chiropractic to sign off on sports physicals and return-to-play decisions.
Ohio is an interesting comparison because they have a very specific legal precedent, right?
They do. The sources cite an Ohio Attorney General opinion from way back in 1983, Opinion 83002. It's a fascinating piece of legal logic that has held up for decades.
1983. That's ancient in medical years.
It is. The opinion basically ruled on a logical syllogism. If a chiropractor is trained and licensed to examine and diagnose patients, which state law says they are, then logically they are qualified to determine physical suitability for sports. You cannot separate the two. If you can diagnose a problem, you can diagnose the absence of a problem.
That seems like a pretty straightforward if this, then that argument.
It is, and that connects directly to the PIAA-aligned bill argument the PCA is making. They argue that existing Pennsylvania law, the Chiropractic Practice Act, already says chiropractors can examine, diagnose, and assume responsibility for patient care.
So if the state law says you can diagnose and assume responsibility, but the PIAA policy says, no, you can't clear an athlete, then the policy is conflicting with the law.
That is the legal crux of it. When a policy from an athletic association conflicts with the state statute, the statute is supposed to win. They believe the PIAA policy is actually out of step with the state licensure law.
And we keep coming back to this, but the professional parity argument is just so strong visually, it's the thing that sticks in my head.
It really is hard to ignore.
You have the Philadelphia Eagles, the Pittsburgh Steelers, the Pittsburgh Pirates, every major U.S. professional sports league, NFL, MLB, NBA, NHL, they all use sports chiropractors.
It just highlights the irony, doesn't it? If a chiropractor is qualified enough to treat an Olympic athlete or a multi-million-dollar quarterback whose health is essentially a corporate asset, why are they deemed unqualified to check a high schooler's ankle?
It's a stark contrast. But I have to play devil's advocate here. Surely there are reasons why this hasn't happened yet. What are the counterarguments? Is this a safety issue? Is it a turf war?
Well, whenever you talk about expanding or confirming scope, you naturally get into a turf war. Usually the concern comes from athletic trainers or other medical groups who might worry about safety or competition. They might think chiropractors don't know how to handle a brain bleed.
Which is a valid fear if you assume it's just a guy who cracks backs.
Right. But the source material is very careful to address this. First, remember the credentials. The CCSP training specifically covers those emergencies. But secondly, they emphasize that this is about being complementary, not competitive.
They want to work with the athletic trainers, not replace them.
Yes. And Dr. Miller's testimony had a really surprising detail on this. He noted that he knows athletic trainers who are frustrated by the current rules.
Really? I would have assumed the athletic trainers would be the ones blocking the door.
Not not necessarily. Think about it. An athletic trainer is on the sidelines. They have a kid with a rib fixation or a sacral issue. They know a chiropractor could fix it quickly. They want to refer the kid to get them back in the game. But their mandate says they can't, or that if they do, the chiro can't clear the kid to return.
So if the athletic trainer's hands are tied too, they can't get the best care for their team because of the paperwork.
Correct. It hinders the team's medical staff from functioning as an integrated unit. And regarding the safety concern, specifically liability, the proposal argues that confirming the scope actually reduces liability.
How does letting more people clear athletes reduce liability? That sounds backward.
Because it establishes clear boundaries. By formally recognizing the sports-certified chiropractors, you ensure that the people on the sidelines are the ones with the right malpractice insurance and the specifically required training. Right now, the ambiguity is risky. Formalizing it ensures that only the qualified ones, the CCSPs and DACBSPs, are doing the job.
That makes sense. It brings it out of the gray area and puts it into a regulated framework.
Exactly. Regulation brings accountability.
So let's bring it all home. What is the PCA actually asking for right now?
They want the state board to issue a formal declaration. They aren't asking for a new law to be passed through the legislature, which takes years and millions of dollars in lobbying. They want the board to issue a statement confirming these rights exist under current law. This would force the PIAA to update its policies to match the state statute.
And the goal is essentially three things: access, cost savings, and modernization.
Access for those rural communities that are basically medical deserts, cost savings for the parents stuck in that endless referral loop, and modernizing the regulations to match what pro sports and other states have been doing for 30 years.
It's a compelling case when you lay it out like that. It's hard to argue with the logic of utilizing willing, trained providers when you have 60% of your counties short on healthcare professionals.
It really challenges us to ask if the regulations are serving the patients, the students, or if they're just preserving an old hierarchy.
And that leads me to my final thought for you listening. We talked about the pros. We talked about the Olympians. But think about this. If a doctor is qualified enough to keep a multi-million-dollar quarterback on the field during the Super Bowl, arguably the highest stakes in sports, what is the actual logic keeping that same doctor from checking a high schooler's ankle on a Friday night? Is this really about safety, or is it just about protecting turf?
That is the question we need to answer.
Thanks for diving deep with us today. We'll catch you on the next one.
Today's discussion wasn't about expanding scope. It was about alignment. Alignment between training and recognition. Alignment between statutory authority and policy implementation. Alignment between community need and available professionals. Doctors of chiropractic with advanced sports credentials are already serving at the highest levels of athletics. The question in Pennsylvania is whether our regulatory frameworks fully reflect the authority already granted under state law, and whether student-athletes, especially in rural and underserved communities, should have access to every qualified provider available to them. When policies create unnecessary inefficiencies, families absorb the cost. When trained providers are sidelined, access narrows. When regulatory clarity is missing, communities feel the friction. If this matters to you, now is not the time to sit on the bench. Get into the game. We are advocating for regulatory clarity. We are standing for student access. And yes, we are defending our right to practice to the full extent of our statutory authority. If you're in Pennsylvania, join the Pennsylvania Chiropractic Association. Support the PCA PAC. Contact your local legislators and encourage thoughtful review of this issue. If you're listening from outside Pennsylvania, connect with your state chiropractic association and support your local PAC. This conversation is bigger than one state. Policy evolves when professionals participate. Until next time, this has been PCA Deep Dive. Stay informed, stay involved, and we'll see you on the next episode.